A lot of patients ask us why we have a BMI cutoff for surgery, and there's a few reasons for that, and I want to really take a minute to explain that to patients. First of all, anybody with a higher BMI has a well-known higher risk of complications, including higher risk of infection, seroma, and fat necrosis. Okay. As you get into a higher BMI, you tend to have a higher visceral fat content, which is something we can't remove with surgery. It's very difficult to get those patients flat abdomens when you do tummy tucks because the visceral fat is like having a 10-pound baby internally, right? Furthermore, the satisfaction with plastic surgery procedures declines significantly the higher the BMI is. Most patients with higher BMIs are not satisfied with their results. And the reason for that is that we can only remove so much tissue safely in one surgery. So if you weigh 150 pounds versus somebody who weighs 250 pounds, that percentage of tissue removed is much smaller than the patient who is only 150 pounds. Therefore, it will feel to you like less was done than the patient who's significantly smaller. So although I may be able to do some of those patients safely, it's not always a safety issue, even though higher BMI patients have a higher incidence of diabetes and issues like that, and then sleep apnea where they can have difficulty breathing afterwards. If we tighten your muscles during surgery, you can have a hard time taking deep breaths. If we had breast augmentation under the muscle, that can be a very difficult time. Patients can end up in pneumonias, being in the hospital for prolonged periods of time. So all in all, it's really best to get your BMI lower because the heavier you are, the higher your BMI is, the less skin there is to remove. It becomes more of a liposuction oriented procedure. And again, we're limited by how much liposuction can be done. Liposuction is not a weight loss procedure. Liposuction is a fat removal and contouring procedure, and it's very difficult to contour somebody who's morbidly obese with the limited amounts of fat we can remove through liposuction due to blood loss. So keep those tips in mind. We recommend a BMI at least less than 33. The ideal BMI is 25 to 28. So at a BMI well over 30, as you continue to go up, the results are going to deteriorate and the patient satisfaction is going to deteriorate and patients are going to be unhappy. So make sure that you see somebody who's well trained in plastic surgery. And if you're a higher BMI, we recommend you get weight loss and see a medical expert. Surgical options or semaglutides, injectable options will help you to achieve a lower weight so that you can get a great result and have a good long-term result.